You can take it away, Eric Johnson.
All right, good afternoon, everyone. Welcome to our November Wellness webinar. Today's topic is about lung cancer awareness. Next slide. Our disclaimer from LDH, Louisiana Department of Health employees, contractors, affiliates have no actual or potential conflict of interest in relation to this program presentation. The content herein is intended for general guidance, not as legal advice. Laws and regulations take priority if there are any differences. Only the Louisiana Department of Health Secretary or Surgeon General can make official statements. LDH cannot speak for other government agencies, and if you need legal advice, you should consult a lawyer. Next slide. Our objective for today's webinar and for all of our Well Ahead Wellness webinars is to drive collaboration throughout the state that connects communities to tools and resources that can improve the health of our residents where they live, work, learn, play, and pray. And with that, I will pass it over to our Bureau Director, Dr. Nancy Lowenthal.
Thank you, Eric. Well, it's a pleasure to be here. Good afternoon to everyone. I want to welcome you to today's webinar on lung cancer awareness, as each November is dedicated to raising awareness about lung cancer, promoting prevention and early detection, and supporting those affected by the disease. Lung cancer is the leading cause of cancer-related deaths in Louisiana, accounting for 27% of cancer deaths and claiming over 2,300 Louisianan lives annually. The most significant risk factor for lung cancer is smoking, exposure to secondhand smoke, radon, and environmental pollution. Early detection through appropriate screening can significantly improve survival rates. Yet only 15% of high-risk individuals in Louisiana are currently being screened. When lung cancer is found at an earlier stage, it is much more likely to be curable. Everyone has a role to play in reducing the burden of lung cancer in our state by promoting quitting tobacco use in all of its forms, increasing preventive screening, radon testing in homes, and sharing the latest advances in treatment. We can empower individuals, families, and communities to take bold action in the fight against lung cancer. Every opportunity to raise awareness, every screening, and every step forward brings us closer to a healthier and cancer-free Louisiana. Well Ahead Louisiana is the chronic disease prevention and healthcare access arm of the Louisiana Department of Health. Our vision is to reduce the burden of chronic disease and assure access to quality healthcare for all Louisianans. We work alongside with leaders from the community, faith-based organizations, local and state institutions, and the private sector to create environments in which everyone can be healthy. We believe that everyone has a role to play in connecting Louisiana communities to a healthier future. We are committed to educating and empowering leaders across the state with actionable steps to move Louisiana's health forward. Again, thank you for joining today's webinar, and I want to turn it back over to you, Eric.
Thank you. Our speakers today, next slide, are Dr. Susan Gunn, a pulmonary and critical care medicine physician with a special interest in thoracic oncology. A New Orleans native and a graduate of LSU Medical School, she completed her residency and fellowship at LSU Health Sciences Center, followed by advanced bronchoscopy training at Cleveland Clinic. Dr. Gunn serves as the System Medical Director for Ochsner Health's lung cancer screening program and is a physician-elected member of Ochsner Health's Board of Directors. At Ochsner, she is an active member of the thoracic oncology multidisciplinary team, performing advanced diagnostic and staging procedures using endobronchial ultrasound and navigation bronchoscopies using a robotic platform. As a national speaker, she focuses on lung cancer screening and nicotine dependence, championing prevention and early detection through compassionate, evidence-based care. In her free time, Dr. Gunn enjoys traveling with her family, cooking, and watching sports. We also have Kimberly Williams, who has been with the American Cancer Society for almost 27 years and currently serves as Senior Program Manager for Tobacco Control. She supports efforts in 4 tobacco nation states, Alabama, Louisiana, Missouri, and Tennessee, working to reduce tobacco-related disparities and promote healthier communities. She is committed to driving change through collaboration, advocacy, and community-centered approaches. So Dr. Gunn and Ms. Williams, welcome, and the floor is yours.
Thank you so much for having me. I wanted to, just as Dr. Lowenthal said, welcome. November is Lung Cancer Awareness Month, and I appreciate the LDH slides that are actually the color of our ribbon. It's often blue. Next slide. So lung cancer, as far as the history in the state of Louisiana, we know that it's the leading cause of cancer death, not only in the state of Louisiana, but really across the U.S. The link between lung cancer and cigarette smoking was actually first described by Dr. Alton Ochsner while he was practicing at Tulane University along with Dr. DeBakey. He was really the first person to pioneer the war on smoking, and there were often, there's all kinds of tales of him at cocktail parties in New Orleans where he's just you know, I wouldn't say screaming at people, but strongly urging people to quit smoking. As of November 2024, there's around 17% of our adult population that still is currently smoking. Next slide. So we know this, I've already mentioned it, that lung cancer is the leading cause of cancer death among men and women. It is the second most common, except for skin cancer, but it is the second most common cancer in both men and women. And how do we prevent it? And how do we detect it early? This is really what the talk is about. Next slide. So health effects of cigarette smoking. Smoking as well, Dr. Lowenthal always described the many risks that come with lung cancer, the radon, environmental exposures, diesel exhaust, and silica fibers is just to name a few. But it's really cigarette smoking, which is really the #1 cause. And cigarette smoking has so many detrimental effects on your health. It causes cardiovascular disease in the form of stroke, heart attacks, peripheral vascular disease, and obviously it causes linked to several types of cancer, including oral cancers, lung cancers, cervical cancers, other dermatologic and conditions like psoriasis, cataracts. And it just is, if you can't get your patients to quit smoking, then maybe if they're a little bit vain, it causes discoloration in their fingers and wrinkles as well. So all of these reasons are reasons to urge our patients and our citizens to quit smoking. Next slide. There's also secondhand smoke. So in our pediatric world, we often encourage parents to quit smoking. We know that it's breathing in secondhand smoke is linked to lung cancer in some, but it can also cause asthma in children and so many other health defects just from secondhand smoke. When it comes to e-cigarettes, the FDA has never approved using e-cigarettes as a way to quit smoking. But also, as I mentioned, Dr. Ochsner first discovered that in 1939. Lung cancer used to be really rare before World War II, and the tobacco industry started giving away free cigarettes to our troops, in World War I. And we knew that it took about 30 years to find that link between that cigarette smoke exposure and him starting to see this rare type of cancer become more common. So vaping and e-cigarettes are a relatively new problem that we have. And so although we see a rapid responses and detriments to your lungs and other organs, I think that it's going to be a disease that we're going to recognize 20, 30 years down the line and start seeing more health effects on vaping. So we certainly encourage all of our young and anyone who's substituting vaping for cigarettes to quit smoking. Next slide. So lung cancer in the state of Louisiana, what are our rankings? And I just kind of, when I was asked to give this lecture and I started thinking about how can we raise awareness in linking cancer and smoking, I just thought about these numbers and I thought, you know what, when I looked at these things, we're so often last when it comes to our to the health of our state compared to our partners throughout the country. But we're not so bad, even though we can do better, and I can show you that. So we are 40th out of 49 for rate of new lung cancer diagnosis at 61.4. We're 43rd out of 47 in the nation for 5-year survival, where it's 28% nationally, it's 23, and that's all stages, all comers. We're 42nd, so we're getting better out of 47 for early diagnosis. We know with all of our cancers that we perform screening, breast, colon, prostate, and lung cancer, that the earlier you diagnose it, the more you have the chance to cure and survive. But when it comes to lung cancer screening, and I have to say thank you because it's out of efforts from LDH and through our MCIP programs that really raise awareness for smoking cessation and lung cancer screening, that we are 30th out of 51 in the nation for lung cancer screening at 15.1% of all eligible patients, which is really low, but the national average is actually 16%. And we know that lung cancer screening reduces death by 20%. Next slide. So this is just another example through the NCI that we're looking at the pie chart on your left tells you that we're still not finding it early enough. But 70% of the time we find it at either it's already spread to the lymph nodes or more advanced where it's metastasized to other parts of your body, brain, liver, adrenal glands. And so we need to find it earlier, more than 23%. And that if you see that the localized on the chart on the right represents survival. And so if you find it earlier, there's a 65% chance of survival of those who are diagnosed with lung cancer. Next slide. This is just a trend, and you'll notice if you look at the bottom line, the U.S. Preventative Task Force recommended that we start screening patients with low-dose CT scans in 2011. And if you look at the trend for all of the different types of cancers, you start noticing a nice trend as when screenings were started and smoking cessation programs came along at the same time, we started maybe noticing a trend of less cancer diagnoses for all comers. And I do think that's a constant effort of just not only getting our patients to quit smoking, getting our citizens to quit smoking, but also because we're looking for things earlier. Next slide. This is another great trend that tells you really the rate by stage of diagnosis. And you'll notice that the top line, the purple line, again, in 2011, if you look at that year, we started diagnosing less of the metastasized, the distant disease, as in it started trending down as we started screening. And the blue line is showing you the localized, the really early lung cancer is on the rise. And those are the people that we're going to get to cure when it comes to it. Obviously, I think it's interesting if you look at 2020, the year of COVID, we did have a little dip in that because less people sought healthcare. But I think we can keep that trend on the upward look of finding more early disease and less advanced disease as we continue to encourage screening. Next slide. And then, as you know, obviously, if we catch it earlier, those survival rates are going to start going up. The interesting thing is with the regional disease as well, which is a little bit more advanced, we're also getting better at that. And we talk about chronic diseases, and sometimes I believe that breast cancer is a chronic disease because we have so many survivors with advanced stages for 20 years and beyond. I think we are getting that we're getting close to lung cancer with immunotherapy and genetic testing, and we're getting better at treating even the more distant diseases that are regional. And so you see that the survival of all of our patients are getting better, and will certainly be better than 23% in the near future as we catch it sooner. Next slide. So just to go back to the same slide that we've already talked about, if we're finding cancer sooner, we have better treatment for it, and we're finding it at an earlier stage, then we can improve survival. And remember, all of our lung cancer screening programs are always linked to smoking cessation programs. It's actually a CMS requirement. So we're really encouraging our patients to not only quit smoking, but to get screened if they're at risk for it. So as that 30th, that middle of the road, as we find more cancer earlier, then I believe that our survival will improve, our smoking cessation rate will improve, and the earlier that's better will also improve. Next slide. We can go on to the next slide. So what about lung cancer screening programs? And I can tell you that every system throughout our state, maybe a couple of exceptions, have lung cancer screening programs. And we all work together to make sure that our patients who get screened have landing spots. So we are a very connected group of people, just because our passion is all about getting detected earlier. So next slide. What is the eligibility for lung cancer screening? It's very simple. You have to be healthy enough to undergo a quick 3-minute low-dose CT scan. You have to be willing and able to undergo a diagnosis and treatment. I think if we kind of take away the stigma that some patients feel of, oh, I've smoked, I've done it to myself. It's an addiction, right? Nobody imagined when they were 12 years old, when they tried their first cigarette, that 50 years down the road, they would still be smoking cigarettes and it would be causing them to be sick. And so we need to encourage patients to be honest and truthful and to want to know to help themselves. They have to be between the ages of 50 to 80. They have to be a current or a former smoker that has quit within the last 15 years. And they have to have smoked, it's called a 20-pack year history, which means, for example, if you smoked 1 pack a day for 20 years or a half a pack a day for 40 years, it has to be the equivalent of 20-pack year smoking history. Next slide. The requirements are very simple. I know within my health system that everywhere there's a CT scanner, that a low-dose CT scan is required. And that means the least amount of radiation, but to get good results so that we can see for standard-sized patients. Our patients are part of our team. It has to be a shared decision-making, which I already talked about. They need to know we're looking for cancer, and if we find it, we want to diagnose it and treat it as soon as possible, and they have to be willing to understand and undergo that. And our radiologists have a very clear standardized identification and classification system so that people are flagged, and that even our lay people within our lung cancer screening team know that, say, if it's a lung RADS 4, which means it's a 9-millimeter nodule, which isn't that big, but it is big enough for us to get a biopsy of it and really and find out what it is. And at the same time, we always make available smoking cessation interventions for our current smokers. Next slide. So we've talked about this, the benefit of screening. It's an easy test. It's a 4-minute CT scan, doesn't require any fasting or an IV with contrast or anything else. If we find it early, we know that treatment, regardless of what stage, the survival will be longer. And it's also important to note that patients don't usually have symptoms when it comes to any type of cancer, really. And the more symptoms they develop, the more likely it is to be an advanced stage. Next slide. So really kind of what I ask of everyone when I talk about lung cancer screening programs, and I think Dr. Lowenthal, when it comes to how do we get more people to smoke, well, we kind of have to just make our citizens feel safe to be honest with us. Because no one really wants to tell you that they're still smoking. It still amazes me that I still know people that are smoking still. They hide it from me, but then every so often I'll find out. And it's not my disease, it's their disease. But you just have to confirm that they're smokers. They have to be honest about how much they smoke. Often patients don't tell us, I smoke a pack or 2 packs a day. And so you just encourage them as what's the maximum amount of cigarettes you've smoked in a day. That way we get them qualified for a lung cancer screen when they're honest. Partnerships are always important. I'm always talking to different individuals about if things are found, where our landing spots will be for our patients. I can say that today I spoke to someone in Montgomery, Louisiana, who had a nodule. And although they want to come down to see me in New Orleans, I did offer them alternatives closer to home, which would be Shreveport. And we have we really have great physicians who can treat all of these patients all over the state. I mean, really just communication. We have navigators within our system, and I know that all other systems have navigators that are kind of the safety net for the ordering physicians and for ordering providers. So the providers are the people who typically order it and have that shared decision making with their patients. But then we want to provide a safety net within for our patients so that no one slips through the cracks. And that's where communication comes in. So that's so important for between our lung cancer screening programs and our ordering providers. Next slide. I think that's it. That's it.
You did a great job, Dr. Gunn. Thank
Thanks.
you. Hello, everyone. So yes, just to echo a couple of things that Dr. Gunn has shared. Of course, ideally, we can educate people on the dangers of smoking, specifically where they would never even initiate it, and therefore we wouldn't have to continue to educate them on the need for lung cancer screening. We know that 90% of adult smokers initiated their first attempt at the age of 18. So, of course, it's imperative that we continue to educate the young people. And there were several things that Dr. Gunn touched on that we need to remember, too, that the tobacco industry is very crafty and they target very specific populations. And the reason being is because they know they can get them addicted. So I am going to talk specifically about cessation, but I just felt like it was important to say we needed to continue to educate on not initiation. So therefore, we don't have to have so much discussion around cessation because hopefully people would choose not to use tobacco. Next slide, please. So tobacco cessation is beneficial at any age. People need to understand that at any age it is beneficial. Cessation improves the health status and does enhance quality of life. It reduces the risk of premature death, and it can add as much as a decade to life expectancy. And the use of tobacco, that it places a substantial financial burden on people who smoke, healthcare systems, and our society. So tobacco cessation can help reduce this burden. There are multiple resources that are available to help people quit using tobacco. Next slide, please. And every state has a quit line. And those of you that are listening today are most likely in Louisiana. And you have an amazing quit line service through your state. It's Quit With Us. And through these quit lines, they're available in each state throughout the United States. Coaching is available in several different languages. There are also a lot of different options in which people can participate depending on how they will choose to participate, whether it's through one-on-one individual counseling, group counseling, text messaging. It is free and confidential. And NRT, nicotine replacement therapy, is available through the quit lines, and there are 7 FDA approved medications for adults. And it is proven, it's scientifically proven that if people do quit services through multiple options like these three that are listed, their success rate will be much higher. Next slide, please. I am with the American Cancer Society and I'm proud to say that the American Cancer Society also has a cessation support service. It is not as comprehensive as the state quit line, so we do like to make sure people understand there are multiple options, but the Empowered to Quit is free as well. It's personalized, but it's email based only. So if people are not comfortable in having verbal conversations, individual one-on-one meetings, counseling, this is an opportunity for them to get the help that they need through email communication. So once they choose a quit day, the participants can start making a quit plan through these email communications, and they will continue to receive tailored emails for them specifically, and they will also receive tools from our organization to help them on their quit journey. This program also helps the participant to understand when and where they are when they most likely feel like smoking. Are they choosing to smoke because it's a coping mechanism, or is it a craving? And of course, these emails also help them set that quit date and hopefully stick to it, where the end result is they will quit using tobacco. Next slide, please. And we were excited that this call was today because it's the day before tomorrow, which is November 20th, and it's the Great American Smokeout. Hopefully everyone has heard about the Great American Smokeout. This is the 49th year the American Cancer Society has had this day. The American Cancer Society is available 24 hours a day, 7 days a week. You can see the information here on the slide. We like to say that because what tomorrow is all about is hopefully those that are using tobacco, it's their day one. They will choose tomorrow to be their day one to attempt to quit. And we do say attempt because we don't want anybody to feel like if for some reason they're not successful on this first attempt or their 7th attempt, that's okay. Because it takes multiple attempts for many people to truly end tobacco because it's that addictive. We are here to provide resources. There's a bunch of links on this slide. I believe this will be shared out with you. And if you are currently a tobacco user or you have a loved one, a family friend, whomever, coworker, please encourage them tomorrow to let tomorrow be their day one to attempt to quit. Ensure that they are aware of these resources that are available. And then I also encourage you to please go on to cancer.org. You can go cancer.org, Great American Smokeout, and you will see these images. And please use one of our social media assets tomorrow on your personal social pages or through your employer if they'll allow. Help us get the word out that we need people to have tomorrow be their day one. And I believe that's all I have. I believe. Next slide, please. Yes, thank you.
Great. Well, Dr. Gunn and Ms. Williams, thank you so much for the information today. And everyone, you can see on the screen here contact information if you have questions to follow up with them. But we'll move into our Q&A at this point. If you have any medical questions or need medical advice, please consult a physician. But if you have questions for, I guess we have a physician to be fair, but nevertheless, if you have questions about the content from today's webinar, you can drop those into the Q&A section. We'll be checking those. I'll get us started with a question. This is for either one of you or both of you. How can public health agencies better reach high-risk communities to increase both screening and early detection?
I've always done community health fairs, and I mean, I do think it raises awareness, but it has to be linked. There's always a booth for smoking and a cessation and a booth for lung cancer screening, and they should really be linked. I think that's a great way for community outreach. I know that we do a lot of just advertising and flyers, and understand that Louisiana is a little bit unique in that often we have smoking cessation clinics really in all of our healthcare systems that are free because of litigation that we've won. Although we don't always still get the money for that, most of the state of Louisiana has won. Although most of many of our healthcare systems have really free smoking cessation clinics that not only have individual appointments, but they also have group appointments. I think that patients a lot of the time benefit from just kind of working through it together and strategies that they've used to quit smoking. And I love, I love Kimberly's point that uh, you can try, we want you to keep trying, right? And so, and be encouraged to keep trying. She said 6, 7, 8, you know, no matter how many times the patient has been to our smoking cessation clinic, I still order a referral to the smoking cessation clinic just because it's so that it can be another touch point that they'll reach out to them again and to remind them that, that they can do it. Another important thing with the communities is that, often it's families that smoke together. And so I often encourage families to try to quit smoking together, the spouses and the children and everything else. Sorry, Kimberly.
No, you are totally fine. And I totally agree with everything you said. I was just reflecting back on the question, and I would just like to share, we are very fortunate to have the amazing partners that are on the ground working every single day in Louisiana, working to ensure that people are educated on all things and specifically smoking and the dangers of it. We do have community health workers that do an amazing job. And of course, a lot of times, unfortunately, there are many people that are not seeing a provider. They are not seeing a doctor. And so it's so important in situations like this, we're taking the opportunity, and now we are all hopefully going to leave a little bit more educated. And so I challenge each of you to take this knowledge that you've learned today, and when you find yourself in a position where you're able to educate, please take the opportunity to do it. Sometimes we, aren't comfortable in talking about things because we're afraid we might not know all the details. But what you do know after today is that smoking does cause lung cancer, and smoking is the most preventable cancer if people just choose to make different choices oftentimes. And and more importantly is ensuring that they know where the resources are. We don't want anybody to feel like what they're doing is so terrible that they can't get help. We want to help. We want to help them quit using tobacco. And so please, each of you share the resources out, however that looks in your network. And again, just so incredibly thankful for the people on the ground every single day already doing the work.
Thanks, Dr. Lowenthal.
Yeah. First, I just wanted to thank you both for such an excellent presentation and for just the wealth of information and the complete dedication to the health of Louisianans. So thank you so much. Ms. Williams, I wanted to go back to you around youth smoking. And maybe, as we're probably most likely to be adults listening to this and participating in this webinar, what should we all be doing within our community to help detect and prevent youth smoking? What are some of the additional strategies? You've started to discuss some of them.
Yeah, and that's a really loaded question, honestly, because there's so much that could be done.
What's the most practical especially for parents and for people who come in close proximity with youth in their own community?
Yeah. Well, first and foremost, policy has to be mentioned. We have to ensure that there are policies in place in all of our states to ensure that youth can't get their hands on it to begin with. There are policies that are established in a lot of areas. However, youth continue to get their hands on it. So as parents, to target that specific question, educate yourself, because again, the tobacco industry is so incredibly crafty on how they're able to get the product into the youth's hands. And in this day and age, I wish I could share a couple of pictures with you, but there's several pictures. You can Google it, you can look. But I mean, vapes in this day and age, they look like office supplies or school supplies. It could be a string on a hoodie. It could be on a phone, a smartphone. If they're bringing home something that looks like a game, it truly could be a flavored vape. I mean, it's just mind-boggling the things that vapes are coming in now. So check the backpacks. have a discussion with your children. I personally have sat on a couple of webinars that Louisiana has done that is student led, and it's been quite amazing to hear the testimonies from the students themselves. And so just equipping the children too to say, it's okay to say no. Don't feel like you have to fall into the peer pressure. But that's hard. That's hard to do. But just quite frankly, being aware of all of the different devices that are out there and keeping your eyes open, and hopefully having a discussion before. Hopefully it's not found. Hopefully it's not found in the backpack, but having the discussion beforehand. But then if it is found, being comfortable and sharing. We know that there's 1,500 youth every single day in the United States that start smoking. And I wish I knew the number off my head that it is for Louisiana, but the national average of adult smoking is 10%. And of course, Louisiana being a tobacco nation state, that average is going to be a lot higher. So.
Well, thank you. Excellent advice. And I think we have a few questions in the chat.
Yep.
One, which is related back to what you were just talking about. We'll go through them. Thank you.
So the first question is, the person said they think it's interesting that lung cancer screening requires shared decision making, whereas perhaps that's not a requirement for other types of cancer screening. And while they love the transparency, do you think that that might deter patients from getting screened?
Thank you for that question. It's a great question. I think the reason for the shared decision making, and I could talk about this all day long, so I tried to be brief. The reason for the shared decision making is that a colonoscopy just looks at your colon. A mammogram is just an image of your breast, and in a CT screen is really an in-depth screen that goes from the top of your neck to really the top of your abdomen. So there's a lot of what we call incidental findings in there. So it's a little bit about if we find something, it might be cancer. And there's a lot of false positives when it comes to it. Nodules are very, very common, even amongst those that have never smoked a day in their life. If you think about it, we're always breathing in air. And so nodules are very common. So there's a lot of anxiety associated with it. And so it was kind of CMS's way of just kind of making sure that patients understood what they were doing, and an opportunity to educate them on false positive findings, meaning there's a spot, but it doesn't represent cancer. And then we may find something else that we'll have to look into, like a thyroid nodule or a spot on your kidney or something else like that. So the shared decision making is just, you want to make sure that they're healthy enough to undergo it and will undergo it. And I do think a lot of it is associated with the stigma. Even now, that we do such a good job of doing this, patients are like, well, I've smoked, what does it matter? And I'm just, that's just not what we want our patients to think.
Thank you. Another person asked, I understand many youth are starting to smoke or use vapes at an early age. How do parents recognize children are using vapes other than physically finding the vape itself?
As a parent, I'm terrified. I have nieces and nephews that are now adults and went through college and everything else. And fortunately, none of them vaped or smoked or anything else. But they would often tell me that, on college campuses, because it doesn't have a sense that it's youth or just, they can do it anywhere and nobody will know, just as a parent and someone of youth. And so it's really, as a parent, it's just keeping those open-ended questions. And I'm a little stickler, like, I'm going to look through things if I want to look through things. So, but it's tough. So that open line of communication as a parent, I think is so important. And know that you're not going to smell it on them. It's not, it's not a beer, it's not a cigarette. So you really have to do it. I will say that my daughter had she had someone visit last week to her school, just talking about really vaping and smoking, not even about drugs, which was encouraging for me to know that that we're doing this pretty frequently in all of our schools.
Yes, I would echo that. There's a lot of great education taking place within the schools in Louisiana, which is amazing. And I would just maybe add, just watch for behavior. If they're not sleeping well, if they seem anxious and then might leave to apparently go to the bathroom and then they come back and they're a little bit more calm. I mean, perhaps, they've gone into the bathroom and vape to help the jitters, because it's very addictive. And so if they're absent frequently, that might be an indicator that there might be something going on. So just watch for, behaviors, and if there seems something that all of a sudden is different and not certain why, that'd be a good time to probably try and have some conversations.
Thank you. I have one more question. So if I think a lot about harm reduction, and if a patient comes to you or a person comes to you, someone who's currently using cigarettes, whether they have been screened and nodules are found or not, and they say, I would like to do something to reduce my risk, but maybe I'm not ready to even try, or I've tried and it hasn't worked to stop smoking cigarettes. What does harm reduction look like in terms of tobacco use and risk for lung cancer?
Often patients that come in with a lung cancer screen and are smoking, there's something else there might be a little bit of emphysema that's found on their CT scan. There might be a coronary artery calcification, so that coronary artery disease, which is also kind of the benefit of it. So the harm reduction is, even if you don't feel bad now, because everyone's fear, who are smokers, even though only 15% of smokers get COPD, but their fear is to be on oxygen or to not be independent. And when you think about the harm reduction of smoking cessation by stopping smoking today, their risk of having a heart attack goes back to normal, as to someone who never smoked within 5 years. So their risk of cardiovascular disease goes back to someone of their same genetic makeup. I mean, we can't take away diabetes, but well-controlled diabetes and stuff like that, their risk goes back to 0. If there's emphysema present, and they're not symptomatic from it, that emphysema, that damage that's occurring daily to their lungs stops immediately. So they may never develop symptoms of emphysema with shortness of breath. They may never require oxygen. And then, because that really is their greatest fear. And then in remaining independent, they will always remain independent if they quit smoking today with the harm reduction. And so there's just so many benefits. Their peripheral vascular disease, your risk of stroke and stuff like that. So they just, and I always encourage, I'll take one less cigarette a day than a pack. And so you just encourage them just to take it day by day, and that, remember, one less cigarette is better than none. And so that's kind of how I approach it.
Thank you. I think we don't have any other questions, so we can go to the next slide. And I'll pass it over to Dr. Lowenthal.
Well, I really want to thank both of our speakers today. Dr. Gunn, thank you so much for your commitment to the health of Louisianans, your encouraging message about the ability to not smoke and how we can do that, but also how we can, if we are smokers, the benefit of stopping and stopping at any point. So it's whether it's stopping early on, of course, would be best, but stopping. And that stopping doesn't happen, maybe it doesn't happen all at once. So that's also encouraging, but every less cigarette you smoke is on the path to improving your health. So thank you for all your work to prevent and treat lung cancer and creating this enabling environment for Louisianans. And I really want to recognize Ms. Williams for your work in Louisiana, for your work in the region, for your determination to really help people not smoke, but to help people quit smoking. And that lung cancer is a preventable disease. And we're so grateful that both of you are working in this state. Do you want to reinforce that tomorrow is the 49th anniversary of the Great American Smokeout? This is actually being celebrated all over the US. Every person we can get to prevent smoking or stop smoking is a huge win for both themselves, their families, for their communities. And I hope, as Dr. Gunn said, that tomorrow will be your first day that you choose to quit smoking. And with that, we just want to thank all of you for joining today's webinar. We hope you're leaving with valuable insights and practical tools to enhance your well-being. Remember, wellness is a journey. Small, consistent steps can lead to meaningful change. Stay mindful, prioritize self-care, and support one another in this journey. Please, if you have any questions on this topic or others, please reach out to us. We also were very grateful to the information that our colleagues have shared today. This webinar will be posted and you'll have access to all the information. So we hope you stay well, stay inspired, and we look forward to seeing you in our next session. And I want to thank our moderator, Eric Johnson, as well. So back to you, Eric.
Thank you so much. I think you said it for us, but thank you, Dr. Gunn and Ms. Williams. We're walking away today more enlightened and empowered. If you need to know more about Well Ahead, you can go to our website, wellaheadla.com, or email us at wellahead@la.gov. So thanks, everyone, and have an excellent day.
Thank you all so much.
Thank you.
Thank you.